like Carol Uncut.
Yes.
Yes. Okay.
Carol Uncut. That's it, man. This is MacKinnon Uncut.
Yeah.
So, hi. I should start with a hug, don't you think?
Usually there's a table between us.
Yes.
Yeah.
Do you
want one?
At this point.
So, when did your work with public health begin? Tell us about your role, where it was, and maybe any memories that you have around that first job description.
Job description.
Well, the work that you did.
So,
I said job description.
it was January, Catherine was right, 1989. So I came on as the administrative coordinator, sexy title, for the Fundy Health Unit. And the Fundy Health Unit at that time was Kings, Annapolis, West Hants, and East Hants. Reported to a medical officer of health, and at that time, the province didn't have enough medical officers of health, just like now. So the person that I reported to, Dr. Wayne Sullivan, was in Halifax, so he wasn't even in the area. We had public health nurses, public health inspectors, a public health engineer, dental hygienists, and nutritionists. So that was it, and LPNs. So my job was to be responsible for all the money, all the HR stuff, all the program planning, the operation of the offices, and since there were only two managers, one being for the nurses and one being for the inspectors, I was responsible for the hygienists and nutritionists. So that was kind of my role.
What was the biggest surprise for you in this role?
I don't know whether there were any surprises. I had come from the federal government in Ontario, Ottawa, to Nova Scotia. So I had a double header. I had what was Nova Scotia like, not being in Nova Scotia, not being in the Fed. So for me, there was just a lack of process. It was very informal. So a lot more conversations happened. A lot more kind of going out into the community happened. And that wasn't my experience before. It was really sort of things didn't happen in communities. Things happened in meetings. So I had a bit of adjustment to get used to.
How did you reconcile that for yourself? Sorry, that's off script. I'm going to get in trouble for it, but it's fine.
I don't think there's any reconciliation. I think you just get in there and do it, right? You just start to go out with people and learn about the communities. And a little less anal around, was there a template for that? Was there a policy for that? How do you fill that out? And just take it down a notch. I think in Ottawa things were fast-paced, a lot of paperwork, and here it was very informal, and you had to actually go out and talk to people.
If I had to describe you as an animal, this is off script.
Okay, what animal are you going to pick?
I would.
Oh,
well,
I
what
know.
animal do you think I would pick?
I'm not going to tell you.
Okay, well, I would pick a beaver.
You could have picked something else.
I don't actually think there's any animal that is more industrious and hardworking than a beaver. Name one. Right? The beaver is focused on the, Sheila, you know, you have beavers at the cottage, you watch them. You know how they work. You know that they keep their eye on the goal. So where do you think your industriousness comes from?
So the question actually said,
Back to the template.
around endurance and perseverance. And I think
But the crowd would like to know about your industriousness.
people would normally say I'm just stubborn. So I wouldn't have, I work hard, but I don't think of it as work. So when you really love what you do, and I love what I do, I don't see it as I'm doing work or I'm now at home. To me, it's a blended wine. And because I believe in what we do and I want to see us get there, I just put in the work to do it. And I have to feel comfortable with what I do and produce. So for me, when I feel like I've done that, I'm content. If I feel like I need to give more, I'll give more.
Okay, well, we'll come back to the beaver.
A beaver, though, like a beaver. Now I can't get that picture out of my head. Beavers are cute. Beavers are cute, but
Well, we need to rethink the theme for the party then.
This was a test run, Melanie, and it's fine. There's plenty of time.
Snapchat filter,
It's better than lately. She's
There
been
was a
calling-
beaver Snapchat filter.
We'll ask them to bring it back. I'll contact Snapchat.
It's better than the old doll, because she's been calling me an old doll lately. And Coombs and I, she's been saying the old doll, so beaver might be better.
I've really enjoyed it.
Yeah.
I really have. Well, you know the old dolls. Noma likes it too, yes, Noma likes it.
The old
Back
doll.
me up, Noma. What were the most important lessons that you learned early on?
Get out of the office. So get out behind your desk, get out of the office and go. And I still do that. I don't spend a lot of time sitting behind a desk. So I think you learn from driving with people. There's nothing like a good
Smoothie
road
ride?
trip
Smoothie road
to
trip?
get to know someone. And I remember when I first took the senior director job, the senior director of primary health care and I, we did a road trip to Sydney, and there's nothing like getting that bonding happening early on. We are still really close, and I think it's partly because we did that road trip together.
I think it's because, I'm sorry, I'm the interviewer, but Lynn Edwards, when she first met you, what did she do? What was the first thing she did?
She hugged me.
Yeah. there.
Yeah.
That's
I'd say the other piece of advice I have is get dirty and get your hands in it. So for me, I learned by getting in there. And I remember back in 1989, I was responsible for inventory furniture inventory. Eileen Brown and I went in the car and we drove to Shubenacadie. We went to every office and did the furniture inventory. Well, you got to meet people. I did the darn annual order, so we went in the stock room and we counted those pamphlets. So don't be afraid to get your hands dirty. It's important to do that. And I think the other thing I would say is it's okay to have some fun. Don't hesitate to make things fun, and that doesn't mean purchasing something. It just means it's okay to.
in the van.
Yeah, it's okay to be a little silly sometimes. And I remember back in Yarmouth at an all-staff meeting, and for some reason, they had me in a tiara and doing dancing, so don't be afraid to have some fun.
That might be a sub-note for June 22nd.
Maybe there's evidence of that
There could
somewhere.
be some tiaras in your future. And beaver teeth, I'm just saying.
Oh my God.
Was there a moment, and she doesn't like this one, but I'm going to ask it anyway. Was there a moment, Carol MacKinnon, in your 29 years with public health, I can't even look at you, when you wanted to throw in the towel? And it might have been this week. I'm just saying.
I might want to change my mind on that one. I'm not sure I ever wanted to throw in the towel. There were probably 2 times when it was like, one was in 2009, 2010, and I was in Halifax on a secondment. And one of the things we had to do was develop a core program framework. Talk about poke your eye out. Oh my gosh, the purpose was to look at a framework for our public health programs. And that was before we had our standards and our purpose statement and our strategic plan. We brought a bunch of people together, and it was really difficult. we finally landed on a framework which rolled into our standards eventually, but I don't think we had the right people. I don't think we had enough of the grounding documents. It was really frustrating. It was like, forget it, like we can't do it. But we did produce something. I think the other time was when we were 3 districts, so Annapolis Valley Health, Southwest, and South Shore. We were operating as a shared service in public health, but other areas weren't. They were operating as districts. And one of the things that we wanted to do was divide up the money. Well, there's nothing more contentious than trying to divide up money while still be a shared service. And I think that one almost did me in, because we were down to the who has that telephone and does that belong in Yarmouth, or where is it in Wolfville and where is it in Bridgewater. It was a ridiculous waste of time, and thank God they blew it up after that. It was a huge waste of time to do that.
So in those 2 examples, what did you draw on? Like, how did you know, by that time you could have went somewhere else, or did, worked for another program, or looked for another job, but you stayed with public health, so how come?
Because in both cases, they were just small things in the big picture. I mean, whether or not you end up with a core program framework, who cares on the ground, right? Do you really care if you have a core program framework? Probably not. So it didn't really matter in the big scheme of things.
Probably 2 groups in the room. I'm just saying, there might be a line, there might be the framework people, and then the other people.
And then for the money, at the end of the day, we were still keeping a shared service. So built into the MOU and the finance was that we would be a shared service. So that to me was the win. Figuring out where the money went, I thought we could probably do a creative accounting at the end of the day, so it didn't really matter. I'm the prize kid.
Yeah. What are you most proud of?
Yeah, I think the zone.
I mean, other than me.
I think the zone as a whole. I mean, I love the Western Zone. And not to say that I don't love the other zones, but I love this zone. And the other thing was the strategic plan for public health. So for the very first time, we had a strategic planning process as a system. Even though we were in DHAs and there was DHW, we decided to take it on as a system. And we decided to do it very differently. So some of you in the room remember the art of hosting phase. But we actually had large stakeholder gatherings where we asked people about public health. And we engaged a large group of folks in that process. Why I also like that one is because really and truly, if you go back, it stemmed from some work we were doing here in the Western Zone in 2009. And I can't believe we actually called ourselves this, but we were called Peas in the Pod. Peas in the Pod.
It was a
Who
joke.
Was the pea in the podder? Yeah. See?
I'm not admitting it in public.
So this
I think it was a
group
joke.
was responsible for any kind of change and transition. And through the process, we met someone. We met Tim Mary. Tim Mary had just moved to this province and was at that time in Yarmouth, I believe. We invited him into this group to learn about different ways of practicing, and it was when we began the strategic planning process as a system, I reached out to Tim and I said, I think you could actually help us in this. And he was on the phone, he said, no mate, I can't do voices like you can.
No, mate.
No mate, that I don't do government. And I was saying like, this isn't really government, Tim. He said, I don't do RFPs. And I was like, you're gonna have to do an RFP. We can help you with that. So, and I think that was something that really, we ended up with a great purpose statement. We ended up with a great strategic plan. From that came things like, I hope you do love, the standards and protocols, but that was a great process. Love it. And it started here. How's it
Shocking.
leakage here?
Shocking.
What do you see when you look in your crystal ball for the future of public health in Nova Scotia?
I see lots of work ahead. I really do. I think we have a lot of opportunity to make a difference in the health of Nova Scotians. I think we have to get over ourselves a bit. So there's always been this sense of, oh, we're public health, we're the poor kids, we're the people that are going, remember us, remember us. Back in the early days, there was a whole process with fans around the invisible public health. Well, get over that. Really, it's about telling our story, like we saw. Tell our story, focus on the results, get the data. We don't do enough of that. So what are we measuring? Where are we making a difference? Yes, it is the long term, but there are things along the way that we can certainly tell, count, share. We've got to do that more. I think we're well poised to do that, but we really have to get over ourselves around that. We're not invisible. It's not about us. It really is about what are we doing to improve the health of Nova Scotians, and we are doing that. So don't hesitate to share that.
That's a
That
good
might be a bit
answer.
of a rant.
That's a good answer. That will
Oh, you're
probably-
judging my answers.
No, I'm sorry.
He's judging my answers.
That one 9 points.
Okay. What would push it to 10, Andre? A hug. Oh,
Do you have any worry areas?
worry areas.
Yeah, for our future. We're still in the future question with your.
So I think there is some worry areas. And for me, we've had a different culture. So I think we're gradually getting out of this participatory leadership culture that we created into a more, there are people that have to make decisions and not everyone has the same level of decision making. I think we're coming out of that. But it is the sense of entitlement sometimes, and I think it's fresh in my memory, having been through something we're going through in Central Zone. We use taxpayers' money. We're paid by taxpayers, we're using their money. We have to respect that and value that. We're not entitled to go away to a hotel and have a conference. It's not about that, it's about how are we spending that money. So I think it's that sense of entitlement that worries me, and I don't know where that comes from, but it does worry me. And I've seen it crop up, not just in Central Zone, but I see it sometimes when I'm out and about. And I don't know what that is.
The structure and how public health is organized across the country looks quite different. And
Right.
so we are in the unique position in Nova Scotia where public health is part of the healthcare system. How do you see that as an advantage?
So everyone needs a home. I've always said it, everyone needs a home. You can't just be out there on your own. So having our home as health is not bad. Health is a big ticket item in this province. So we have to figure out how to use that and leverage it for us. I think we're just starting to realize the benefits of being in health. So, Shelley Moran and I just talked about, we're getting cash registers for schools because we're part of NSHA. They're ordering them for their cafeterias. We're gonna piggyback on that. How can we piggyback on some of those things? I also see it at the tables I sit when you ask different questions. I mean, people understand that health is more than service. They get that. but sometimes they need a little bit of help around how do you translate that into my work? How do you translate that into what we measure? How do we pay attention to that? So I think public health is well poised to ask those different questions, to really be out there and say, have you thought about the impact of that on some of our more vulnerable groups? So I think health is okay. It's a great place to be at the table, but we haven't leveraged that opportunity as well as we could. I'd rather be in health than justice. Yeah. So it's not a bad place. Community services, I mean, there are places where it's either with municipalities or there's been a try around that health and community services. I don't know that it's been any greater or different.
Is that music like on purpose? Or is it
That's
just
it.
feels
That's an
right
interlude
now?
until I read the next question. Thank you, Sonia.
Move along.
What will you tell your grandkids, Carol, about working in public health? And I know the early years is going, oh, that's a good question. Tell the truth, Angie. You like that
So
question.
when I read that, I thought, she knows something I don't know. We don't have grandkids yet. I actually don't know what I tell them other than it was a lot of fun. I met a great group of people. Like you still have those moments of doing things differently, meeting some people like Peggy Hope Simpson. And Peggy Hope Simpson is someone in Wolfville that is just an incredible woman. And when she, called me to the deck of her house to have a conversation, I went. Those folks will always stay in my mind. People may know I don't love flying, so early on, when I was being managed from Halifax and it being in Windsor, I was told to kind of go down to Yarmouth, Digby, and Shelburne and provide support for the MOH there. And one of the things we had to do was we had a trailer in Freeport where the nursing services were delivered from, and we were to find another location because the trailer was unsafe. So anyways, I was picked up by a helicopter, and it was a helicopter from Natural Resources that my boss had secured, and we were going to go down and spec out a new location for the trailer on Freeport to get the nurse out of there. And that was an incredible, because I'm like, I can't look, because I can't look at the ground because I'm terrified. And he goes, we've actually never been to Freeport. You have? Where's the trailer at? Oh my God. I'm like, oh, now I have to look down. So we landed by the trailer. We ended up eventually finding a house for the nurse to live in and work from. And then we closed Freeport office and moved to Digby. But those are the stories that road trips, traveling with folks together. There are probably lots of them. Yeah.
Will you let your grandkids change the template?
Depends.
Just wondered.
Most importantly, Carol, where is the best coffee served in Nova Scotia?
Yeah. So it's funny because every time I went somewhere, people would say, oh, we've got a new coffee shop open, let's go. So, Doris would take me someplace different in Yarmouth, or, Barb Anderson would take me someplace in Bridgewater. I think there's good coffee everywhere. I don't have a favorite. And people will say, you only go to those special shops. No, I've been known to go to other shops. And there was nothing like the Bridgetown Tim's when they opened that one off at a 101. That was a lifesaver, because going from Wolfville to Yarmouth, you knew that you could stop there. I don't
You
know
can
what
stop
it
in
is.
Matega now at SIP.
Oh,
Yeah.
yeah, see? There are all kinds of great coffee shops that I have been at.
So last question, Carol. What do you want there's a number of new people in the room. What do you want the new members of public health, what do you want them to know?
So for me, there's lots to know. I think we have to go back to the very basic, what is public health? Public health just is not the standards and protocols. That gives us a framework. It really is about our values. Fundamentally, values around social justice, values around working with communities in a very different way. That, to me, is public health. And when you meet people that work in public health, it's different. I mean, the passion that folks bring around the work, you don't see that in other areas. So for me, it's about get yourself connected with someone who has been in public health, get out there and do the work, meet people, know who's in your community. It's not just what's on paper, and I think there's lots out there. Yes, the paper's important, and I mean, it's important that we're doing work that is evidence-based, and I think our new science...
Such as icebreakers.
Yeah, well, thank you for that. You know, our new Science and System Performance Unit can provide that evidence base for us. We need to actually know what the evidence is. We need to be able to translate the information. So it's not, you know, coming to the table and debating whether or not health equity is defined properly. Get over that. It's really, what do you understand about health equity? What do we need to do to improve? And how do we get there? Less talking about the definitions and more about what is the work we need to do together to make a difference.
Aren't you glad I did the interview? So thank you for